Seasonal affective disorder is a major form of depression that occurs at the same time each year. According to the National Alliance on Mental Illness, researchers have identified two types of SAD. One which takes place in the summer, and the more common type known as winter depression. But make no mistake, that type is vastly different from the typical winter blues.
Typically, most of our blues around the holidays are kind of temporal. They go away pretty quickly, except for the bills. And then, but seasonal affective disorder tends to come on as the days get shorter and shorter, particularly in the coldest of months, December and January. Most people report the more serious symptoms.
People who suffer from SAD often have symptoms common to depression, such as sadness and anxiety. But this seasonal disorder makes things even worse, triggering effects such as a tendency to oversleep, a lack of energy, increased appetite, weight gain, and even some serious mood swings.
I was crying, getting my feelings hurt over nothing, moody, negative about things. Generally hard to live with.
Lynette Dalton has suffered from seasonal affective disorder most of her life, but until 2 years ago wasn't even aware of it. Back when she was growing up, mental health professionals were nowhere near being able to diagnose the disorder, and those closest to her didn't really know what to make of her symptoms.
They just thought I was in a bad mood, that I needed to cheer up.
Lynette learned to live with the problem year in and year out. But a recent family crisis was more than she could handle. So with the help of her primary care physician, she sought professional counseling.
As we worked together, Lynette would talk about how the seasonal change seemed to make her depression more significantly severe.
It wasn't long before Dr. Donaldson was able to make the diagnosis of seasonal affective disorder and start giving Lynette the tools she needed to cope with the problem. One treatment that works particularly well in Lynette's case is talk therapy.
Just generally being able to come down and talk to Earl about things that are bothering me or things that are making me happy, because some sessions we only talk about some of the good things that have happened, some of the good news in my life.
Some cases of SAD have been linked to a biochemical imbalance. So another option for patients is prescribed antidepressant medication to offset the imbalance. Lynette is following her doctor's suggestion of increasing her medication before the time her SAD would ordinarily kick in, and then cutting back closer to the spring. Research is also showing that lack of light, especially sunlight, can have a detrimental effect on sleep patterns and make the effects of SAD even more severe.
As we move inside during the harsher months, the light that we get, or the light that's available to us, decreases both in amount of time and in the intensity because we're inside more, particularly if you work a job where you're stuck in a cubicle or a windowless room and you're not getting out after work to get into the sunlight.
One method finding particular success in treatment is the use of a light box.
Well, over a period of time, when a person sits in front of a light box on a daily basis, they will start feeling an easing of some of their symptoms.
In addition to a light box or even a light visor, Dr. Donaldson recommends that patients take every opportunity to get up and get outside.
Staying active definitely helps. I have a very busy schedule. I've been very active in my church and church activities. I was involved in some of the political campaigns, but doing those things, I don't always have a chance to get out. However, sometimes I'm out driving, and that puts me out in the sun.
Clearly, seasonal affective disorder, as with any case of depression, is tough to diagnose and tougher to live with. But for patients like Lynette, seeking help is not only allowing them to shed some light on the problem, it's also giving them a brighter outlook for the future. For Smart Medicine, I'm Rod Starnes.
Thanks, Rod. Now, from our cover story, we've seen how seasonal affective disorder differs from the so-called holiday blues. But the holiday season itself can bring on bouts of depression, especially for someone who has lost a loved one. Joining me now to talk about this is licensed clinical social worker Angela Hamblin. Angela, thanks so much for joining us.
Thanks for having me.
Tell us why this type of depression is so prevalent in someone who's lost someone.
Well, when the holidays begin approaching and people see active signs of that in the community, it brings back a flood of memories from holiday traditions in the past that they did with their loved one who has maybe died in this past year. So they're flooded with past memories and traditions, and then now they're faced with the realization that things are different.
What would you do to help somebody who's going through this?
Well, really to sit down and just be very open about it. Actively develop a plan. It's okay to, look at what did you do in the past, what's important to continue to do this year, and what are you okay with not doing. But then also looking at how grief impacts our bodies and that it's important to stay hydrated, to eat well, exercise, and to have somebody that is your point person and tell them, you're my point person. If I call you, it means I need you, so be available to me over these holidays.
Is there some way that the bereaved can honor someone who's passed on during the holidays?
Absolutely, and that's actually very important in the healing process, and sometimes that is scary for families to do. They'll say, we already had a funeral, we don't want to have another one. But there's simple things that families can do, and it's very important for families to do that together, to come together. It strengthens their bonds. They can light a candle. Some families at Thanksgiving will put a basket out, and their family members and friends who come over can write things down that they're thankful for, and then they'll read them, maybe while they're having their Thanksgiving meal. Or to light a candle and say this represents our loved one who's not here with us. Some families even create memory ornaments, which actually can be quite fun because they'll begin to tell stories and reflect, and then they have those things to put on their tree or to use throughout the year.
And realizing during the holidays that you do need to talk to somebody, and that after the holidays you might still need to talk to somebody.
Absolutely.
Thanks so much for joining us.